It's International Safe Abortion Day, and while Malaysian law does allow for safe abortions, at least 5 women have died because of unsafe abortions since 2015. Why? Abortion is legal in Malaysia under certain conditions. Act 574 of the Penal Code, Section 312 says, causing miscarriage is an offense unless a doctor decides that the pregnancy poses a risk to the life of the pregnant woman, or that continuing the pregnancy risks injuring either the mental or physical health of the pregnant woman. All abortions must also be carried out by a certified medical practitioner, and the pregnancy term cannot exceed 22 weeks. Ending a pregnancy without fulfilling these conditions can lead to a 10-year prison sentence for the woman and legal action against the doctor who performed the abortion. If abortion laws around the world were put on a sliding scale from complete prohibition on one end to allowing abortion on request on the other, Malaysia's laws would be roughly in the middle of that scale. Generally, laws have liberalized over the years, meaning they've become more abortion-friendly. 67 countries now allow abortion on request, with the most common gestational limit being 12 weeks. There are exceptions though, notably parts of Latin America and some states in the US. The most extreme example of restrictive abortion laws comes from Romania in the 1960s. Attempting to boost their population, the country severely restricted access to abortion. It wasn't long before illegal back-alley abortions started taking place, and by 1989, an estimated 10,000 women had died as a result of unsafe abortions. The policy was reversed in 1990, and since then, abortion has been available on request for pregnancies of up to 12 weeks, and beyond that, to preserve the life or health of the woman. The result of this was immediate. Abortion-related maternal deaths fell from 148 per 100,000 live births in 1989 to only 58 in 1990.
So there are many countries which have made abortions no longer a criminal offense. The reason given is obviously the realization that where abortions are restricted, illegal abortions by untrained persons will take place. And that is where the dangers are, and that is where you have serious complications, and including women dying from such a procedure.
Despite this, about 45% of abortions that happen around the world are still deemed unsafe, and they cause more than 7 million women and girls to be injured or disabled by complications from unsafe abortions, and more than 22,000 deaths every year. In Malaysia, the recent deaths we mentioned at the start, they were caused when women bought unregulated abortion pills online and took them without the advice of a qualified doctor. 5 deaths might seem low compared to the global numbers, but there is still cause for concern.
The number of deaths from unsafe abortions are very low. This may be due to the fact that our hospitals will take care of many of the complications if there are unsafe abortions. In fact, many patients who come to us either online or who come to my clinic will say they've been to several other clinics or they've rung up some private hospitals and they have been refused. And very often the reception they get when they ask for an abortion, they get scolded instead of being asked to explain why they need to have the abortion.
So despite Malaysia's relatively flexible laws on abortion, many doctors and nurses are either unclear about the law or have personal values that conflict with the idea of carrying out abortions. Now, this situation can get tricky because, according to Malaysian laws, while women can request for an abortion, it is up to the doctor to assess whether the request meets the legal requirements.
But the problem is that interpretation of how severe is your mental disturbance is very hard to I'm saying some people even ask these women to go to psychiatrists to get that psychiatric evaluation of their mental condition. To be able to be taken as serious enough, this pregnancy has been the doctors, really got their own religious value, which they cannot be reconciled, doing termination of pregnancy for not a very good, valid reason.
In fact, pregnancy termination guidelines issued by the Health Ministry in 2012 state that it is not necessary to send a woman for psychiatric evaluation, and goes so far as to say that making abortion safe is, above all, a public health responsibility of the governments. Despite this apparently clear stance, a qualitative study from the same year found that women have trouble accessing basic information about abortion, let alone finding a doctor that will perform an abortion. The study notes the main barriers to abortion were the lack of abortion services and information. Women in this study had the perception that government hospitals do not provide abortion services, as it was illegal. The women felt unhappy as the doctors were judgmental with their personal beliefs that abortion is wrong and sinful. When women have difficulties in seeking abortion services, they resort to unsafe, self-induced methods, which is also admitted by women in the study. At the same time, it is understandable that some doctors are cautious to perform an abortion or promote their services publicly. Although no doctors have been prosecuted for carrying out abortions in recent times, it is a possibility. There are also arguments against making abortions too accessible, that they become almost like a form of contraception.
I definitely feel at the severe distress to terminate pregnancy because no one to use contraception. They don't want to take responsibility over their choice. So this, and I feel very difficult for me to reconcile.
The earlier study we mentioned states that the women interviewed had experienced between 1 to 8 abortions in their lifetime. But here's the thing. Available data seems to suggest that abortion rates are similar in countries where abortion is highly restricted and where it is broadly legal. That just means that where abortion is illegal, they still happen, but they're unsafe. So how do we reduce abortions altogether? Research from Washington University School of Medicine shows that providing birth control to women at no cost substantially reduces unplanned pregnancies and cuts abortion rates by a range of 62 to 78% compared to the national rate.
Preventing unsafe abortions and preventing unwanted pregnancies is our primary objective, right? Comprehensive sex education should be introduced. That means we have school children in their teens who must know about contraception. Secondly, access to contraception must be good. That means there's no judgment, no judgmental issues about single girls or single couples going for contraception.
This is important when around the world about 40% of pregnancies are unintended, and half of these are unwanted and end in abortion. Data from 2005 to 2010 shows that only 32% of Malaysians use modern contraceptives, which is far lower than many other countries. Lack of awareness, myths, and non-availability are among the causes for this low rate of contraceptive use. But even for cultures and religions that don't allow modern contraception, there are natural contraceptive methods that can be used. For example, abstaining from sex during the woman's fertile period. However, they have to be followed vigilantly to be effective. Of course, the only way to achieve 100% success in preventing pregnancy is by abstaining from sex altogether. But given that a large number of women seeking abortions are already married, this advice may not have a significant effect on abortion rates. So, in the big abortion debate, perhaps we should spend less time debating whether a woman or her fetus has more rights and more time ensuring that everybody has access to accurate family planning information and contraception so that every pregnancy is a wanted pregnancy.